Hi, my name's Vicky. I'm a diabetes specialist nurse, and today I'm going to be talking to you about the urine ACR test, also known as the albumin-creatinine ratio. You may be wondering why, when you have diabetes, we ask you for a urine sample. And you may wonder, is it really that important? Sometimes you might provide these samples and then you never hear any more about it. So why do it? Is it important? Well, let's find out. So we know that people living with diabetes are more at risk of developing damage to their kidneys. And this is because the higher than normal blood glucose levels over a period of time can cause damage to the very small blood vessels that carry blood to and from the kidneys. So the damage to these vessels then mean that the protein leaks out of the bloodstream and into the urine. The first sign of kidney damage is protein leaking into the urine. Now, your body does need protein, but only very, very small amounts should be detected within the urine. You may not necessarily have any symptoms if you do have a higher than normal amount of protein in your urine, and that's why it's so important to have this test done every year, along with the blood tests that help to assess the health of your kidneys. For those people living with diabetes, once a year, at least, as part of your annual diabetes review, your GP, practice nurse or diabetes team will ask you to provide a urine sample. You may be provided with a pot, like so. Now, what do we do with the urine sample once we receive it? Okay, so there's two things that we do. We may dipstick it there and then to check that there's nothing in the urine that shouldn't be, but we also then send the urine sample off to the lab. So we take it from this pot here and we draw it into this one here, and the small tube gets sent to the lab. When it gets to the lab, it gets processed and the amount of protein within the urine is measured accurately. If you do have too much protein leaking from your kidneys into your urine, there are many treatments that can help slow the progress of kidney damage and prevent kidney failure. You may also need to be referred through to the kidney doctors at the hospital for further treatment. There are also things that you can do yourself to help keep your kidneys healthy, and these include keeping your blood glucose levels within your target range, having good blood pressure control, stopping smoking, eating healthily and keeping active, and attending all your diabetes appointments and checkups. There is also a blood test that we do to check the health of your kidneys, and this is called the estimated glomerular filtrate rate, or for short, the EGFR. This is usually done as well as the urine test and gives us an overall idea about the health of your kidneys. However, it's important to remember that the EGFR can be normal, but the urine ACR might be raised. And this is because the amount of protein in the urine is the earliest indication of any kidney damage. For that reason, I cannot stress enough how important it is to have your urine checked and sent off to the lab at least once a year. So please, when we ask you for a urine sample, it's really, really important. So please do not delay.